It's certainly a good day here on Welcome to Our Community as I introduce Ms. Stephanie Jones Heath. She is the CEO of the Diversity Health Facility, and we thank you so much for coming to Savannah to be a part of the program.
And thank you for having me. I'm so excited to be here. Thank you.
What makes your facilities so unique?
Well, what makes them unique is they are federally qualified health center, community health centers, and what we do is we provide health care to the community regardless of your ability to pay. So that no matter if you have insurance, don't have insurance, we serve as the gatekeepers for the underserved population. So that's what makes us really different from most private practice and other practices.
And it's so wonderful that you all have this facility or facilities in different counties that are meeting people right where they are.
Yes, absolutely. We are in Liberty, Long, and Wayne County, and we've been around for about 20 years. And I always say federally qualified health centers are the best kept secret. And most people don't know about them because if they knew about them, then they would at least give it a chance. And most people, when they do hear federally qualified health center, they're thinking free clinic, you know, ran down facility. They have this stereotype in their mind, and then when they
not the best care.
Yeah, not the best care. People aren't qualified that's providing the care, and it is anything but that. Anything but that.
You offer full service medical, but also you specialize on some chronic health illnesses.
Oh yeah, absolutely. We serve as a medical home. A lot of people are confused on that part of it too. We're not a doctor's walk-in clinic. We are a medical home for our patients, just like if you went to a private practice and you saw your doctor on a regular basis, that's what we do. So part of that is patients who have diabetes, hypertension, chronic conditions. We treat and manage those chronic conditions because the whole idea is to serve as a medical home to keep those patients out of the emergency room. So that's part of what we do, and that's what's unique about a community health center is we work with the hospitals in order to keep those patients out of the hospital, which drives up cost, which drives up anxiety for the people that have to pay when they go. So it's a very good resource to the community that most people don't know about.
And as we were talking about your locations, you all are so important because in some of those more rural counties, they don't have lots of primary care physicians like we do, say, here in Savannah or even Hinesville.
Exactly. Like in Long County, we're one of the few in Long County. And then even over in Wayne County, we're one of the only ones that see patients on a sliding fee scale based on their income, and we don't turn them away. So we're the only ones in all three counties that provide that type of service outside of going to the emergency room. And so for those smaller counties in the rural areas like Jessup, Wayne County, and Long County, they don't have a lot of the resources. So when they come to us, we don't just treat the health care, we help them with a lot of the social aspects and also managing the chronic conditions. So when you come in, you might not have resources as far as food insecurities, housing, transportation, translation. We provide assistance with all those different types of services.
So you are really just a beacon of hope for especially people who are living at or below the poverty line in certain areas. It must make you all feel great knowing that you are standing in the gap for so many families.
Absolutely. I wake up every day and I love what I do. I mean, most people when they talk to me, they say, you seem so passionate about what you do. I am, because you can't help but be passionate about helping people if you're in healthcare. And like I said, for most people, even if you have insurance, and this is where people are sometimes confused, they think, oh, it's only for the low income. 60% of our patients have insurance. Now think about the insurance market right now. A lot of people have insurance, but their co-pays and deductibles are so expensive that even going to the doctor, they still can't afford it. So coming to an FQHC, you can come in, you can be seen, you have high co-pays, high deductibles, we still can assist you. So that's what makes things really work really well and productive with people who need access to care.
Coming up in rural Washington State,